If you're studying for the PMHNP-BC board exam, you are in the right place. Me too. Today, we're going to walk through some real-world clinical case studies to review foundational topics from chapters 1 and 2 of Neal's PMHNP review manual. We'll include scope of practice, informed consent, treatment boundaries, and legal ethical decision-making. These cases will help you to understand how exam questions are framed and how to apply your knowledge like a practicing PMHNP would. Hi, my name is Cameron Pellegrino. I'm a holistic nurse healer, breathwork therapist, and a psychiatric mental health nurse practitioner student in my final semester, and I'm currently studying, and I'd like you to study along with me. I've created this video to help others studying for the boards as well, so that we're not just memorizing facts. It's helping us to think like a clinician. So we'll walk through some real-world case studies that are tied to exam concepts from Neal's review manual, so you can integrate what you're learning and into how you'll practice. So if you're studying too, you're not alone. I'm here studying with you, and I'm going to help both of us feel more prepared, grounded, and confident. So let's jump in. First, I want to show you which book I'm using. It is this Neal's book, and this is where I'm pulling the material out of to study, and so we'll be reviewing the first 2 chapters of this book today through case studies. So, case study 1, scope of practice, lifespan, and medication management. Clinical summary. The newly graduated PMHNP is offered a job treating adults and children with chronic mental illness and occasional physical health issues like diabetes and hypertension, as we know, can have an effect on mental health, correct? So the question is the PMHNP legally allowed to treat both children and adults? And can they prescribe non-psychoactive meds? Well, let's take a look at this and dig in. We know that PMHNPs are certified by the ANCC, and we are trained across the lifespan. So if the PMHNP is certified as a board certification through the ANCC exam, they can treat children if they are clinically competent. The scope of practice is governed by the State Nurse Practice Act, also within their state. I happen to live in New Mexico, which is a full practice state. And in New Mexico, for example, PMHNPs have full practice authority and can prescribe non-psychotropic medications like antihypertensives or insulin if it's within their clinical training and setting. So please check with your state board of nursing to see what your state Nurse Practice Act says about you prescribing, period, but also prescribing non-psychoactive medications. Always remember to consider the state scope of practice because PMHNPs must stay within their certification, training, competence, as well as scope of practice. And we can use organizations like the APNA, the ANA, to stay informed on different changes within those practice acts. All right. Let's move on to case study number 2 regarding involuntary treatment and legal standards. A client arrives actively psychotic, paranoid, and is threatening others. They refuse all treatment and they deny that they have any illnesses. Can the PMHNP treat without consent? This is a classic ethics legal competency. On the ANCC exam, remember that the treatment without consent is only legal when the person lacks capacity and poses a danger to themselves or others. In most states, PMHNPs can initiate an emergency hold under the civil commitment laws, so please check your state laws. In New Mexico, where I live, this falls under NMSA statute 43-1-1. PMHNPs can initiate emergency evaluation procedures. So key points to remember for the exam on this is the 4 Ds of negligence. Ready? Duty, dereliction, damages, and direct cause. All right. And we also need to consider competence versus capacity. Capacity is often situation specific and can be assessed clinically. We need to remember also to use the least restrictive means first. And if a patient is in danger, we initiate the hold and document everything. Excellent. If you have any questions or any additional things that you would like me to go over, drop them in the comments below, and I'll be happy to make additional videos addressing those or just answer you right in the comments. All right, ready for case study number 3, psychiatric advance directives and relapse planning. That's often very important for a lot of people with chronic mental health issues. So, you remember the client that we had in the last case study? Well, they're going to return 5 weeks later. They're now stable and they're interested in relapse planning. The PMHNP considers using a durable power of attorney. What do you think? Is that something that should be done? Is that doable? Is that within our scope? Well, psychiatric advance directives are evidence-based relapse planning tools, and they help support our clients' autonomy. So using a psychiatric advance directive or a durable power of attorney is absolutely considered best practice for those with chronic mental illnesses. Key concepts to remember. They must be created when the client has capacity. They will help guide future care and reduce the crisis situations. They reduce your legal risk and support ethical treatment planning. Make sure to review your state laws under any Healthcare Decisions Act. All right. Last case study. Are you ready? This one is going to go into depression diagnosis and client education. A 35-year-old denies depression but reports sleep issues, anhedonia, social withdrawal. They're currently on amitriptyline 50 milligrams. The PMHNP diagnoses MDD and increases the dose. So, what do we do here? Be ready to assess clinical judgment questions. So the client may ask you, why are you doing that? Remember, amitriptyline is a tricyclic antidepressant used for depression, pain, and sleep. And if we know the dosing, the regular dosing range, 50 milligrams is kind of a low dose for depression. So it's absolutely within the PMHNP scope to adjust the dose. Remember, for tricyclic antidepressants, the therapeutic dose for depression is 75 to 150 milligrams per day. We're going to monitor them for any side effects, including anticholinergic side effects, as well as QT prolongation. During our interview with them or our assessment of them, we're going to use motivational interviewing so that we can help them understand their diagnosis and the rationale for the medication adjustment. And we're going to document that the client gave informed consent to those treatment changes. So, what do you need to take away from this little study session? Well, under scope of practice, you're going to always check your state law and make sure that you're practicing within your training as well as your scope of practice for your state, because every state, unfortunately, is different. As far as involuntary treatment requires danger to themselves or others, as well as impaired judgment. Okay? And then relapse planning. Relapse planning, absolutely best practice is to include that psychiatric advance directive and or a durable power of attorney with consent while the client is within capacity. Medication management for tricyclic antidepressants are absolutely in our scope, and we want to make sure that we're monitoring them closely. And for communication and ethics use, we're going to use shared decision making, and we're going to document. Well, thank you for joining me. That is today's study session. If this helped clarify some of the tough legal and scope of practice topics for the ANCC PMHNP exam, give this video a thumbs up and hit the subscribe button for more real-world clinical prep. Drop your questions or case requests in the comments below. I'm here to support your journey to certification, and it'll help me learn too. Thank you so much for joining me today.